If you're turning 65, planning to retire, or just trying to figure out Medicare, this video is for you. Medicare can feel overwhelming. With all the different parts, options, and enrollment rules, it's easy to get confused. But don't worry, I'm going to break it down in a way that makes sense, so you can confidently make the right choices. Making a mistake when enrolling in Medicare can be expensive. Whether it's missing a deadline, choosing the wrong plan, or not getting the coverage you actually need, these missteps can cost you. By the end of this video, you'll understand how Medicare works, what each part covers, and how to make the best decisions for yourself or your loved ones. Before we dive in, take a moment to subscribe to the Benefit Genius channel and turn on notifications. That way, you'll stay informed and never miss updates that could save you money and help you avoid costly mistakes. Medicare has four main parts: Part A, Part B, Part C, and Part D. Each serves a different purpose, and understanding them is the key to making informed healthcare decisions. Let's start with Medicare Part A. This covers hospital-related expenses, including inpatient hospital stays, skilled nursing care, hospice, and some home health services. For most people, Part A comes at no monthly cost, as long as you or your spouse worked and paid Medicare taxes for at least 10 years. However, just because there's no premium doesn't mean everything is covered. A common misconception is that Medicare pays for long-term care, like a nursing home or assisted living. It doesn't. Part A only covers short-term stays in a skilled nursing facility under specific conditions and does not include custodial care. Even though Part A is premium-free for many, it still has out-of-pocket costs. In 2023, the deductible is $1,600 per 60-day benefit period. That means if you're admitted to the hospital, you have to pay that amount before Medicare covers anything. If your stay lasts beyond 60 days, daily co-payments also apply. Now, let's move on to Medicare Part B. This is your medical coverage. It helps pay for doctor visits, outpatient care, lab tests, preventive screenings, ambulance services, and durable medical equipment. Unlike Part A, Part B requires a monthly premium. In 2023, the standard premium is $164.90, but depending on your income, you may have to pay more. Part B also comes with a deductible and co-insurance. In 2023, the annual deductible is $226. After you've met that deductible, Medicare covers 80% of approved services, while you're responsible for the remaining 20%. This is where many people get caught off guard. Unlike employer health insurance, there's no maximum out-of-pocket limit with traditional Medicare. That means if you need frequent doctor visits, expensive tests, or outpatient procedures, your costs can add up quickly. This is why many people choose to get supplemental coverage, which helps cover those extra expenses. We'll talk more about that in a bit, but for now, let's move on to Medicare Part C. Part C, also known as Medicare Advantage, is an alternative to original Medicare. Instead of getting your benefits directly through the federal government, Medicare Advantage plans are offered by private insurance companies approved by Medicare. These plans combine Part A and Part B coverage, and many also include extra benefits like vision, dental, hearing, and even prescription drug coverage. Some Medicare Advantage plans offer lower out-of-pocket costs than original Medicare, but they come with provider networks, meaning you may have to use doctors and hospitals within the plan's network to get full benefits. It's important to compare plans carefully. While some offer low or even $0 premiums, costs can vary based on coverage, location, and specific medical needs. Some plans have higher co-pays or require referrals to see specialists. Now, let's talk about Medicare Part D. This is your prescription drug coverage. Part D plans are offered by private insurance companies and help cover the cost of medications. Even if you don't take any prescriptions right now, signing up for Part D when you first become eligible can help you avoid late penalties down the road. Each Part D plan has a formulary, which is a list of covered drugs. Different plans cover different medications, so it's essential to check whether your prescriptions are included before choosing a plan. One thing to watch for is the donut hole or coverage gap. This is a temporary limit on what the plan will pay for your medications. Once you and your plan have spent a certain amount on prescriptions, you'll enter the coverage gap and may have to pay a higher percentage of your drug costs until you reach the out-of-pocket limit. Understanding these 4 parts is just the beginning. Medicare can still be confusing, especially when it comes to choosing the right coverage for your situation. That's where supplemental insurance comes in. Also known as Medigap, these plans help cover costs like deductibles, co-insurance, and co-pays that original Medicare doesn't pay for. Medigap policies are sold by private insurance companies and can make a big difference in how much you spend on healthcare. Unlike Medicare Advantage, Medigap plans work alongside original Medicare instead of replacing it. However, you need to have both Medicare Part A and Part B to enroll in a Medigap plan. And unlike Medicare Advantage, Medigap doesn't include extra benefits like vision or dental, so you may need additional coverage for those services. Another key point to consider is enrollment timing. The best time to sign up for Medigap is during your 6-month Medigap open enrollment period, which starts the month you turn 65 and are enrolled in Medicare Part B. During this time, you have guaranteed issue rights, meaning insurance companies can't deny you coverage or charge you higher premiums due to pre-existing conditions. If you wait until later, you could be subject to medical underwriting and might pay more based on your health status. Medicare decisions can be overwhelming, but taking the time to understand your options now can save you money and stress down the road. If this video helped clarify Medicare for you, be sure to like this video and share it with friends or family members who might also need this information. And don't forget to subscribe to Benefit Genius for more updates and insights that can help you make smarter financial and healthcare decisions. Thanks for watching, and I'll see you in the next video.